Well, good morning. I'm Dr. Cynthia Shaft Toll. I'm a chiropractor here in Canton, Michigan, and I am interviewing today actually he's my personal MD that our family sees when we have issues. I'm a holistic doctor, as you can see, and Dr. Brownstein is the owner of Centers of Holistic Medicine. He's the medical director there. I just want to read a little disclaimer. It's not intended to provide medical advice or to take the place of such advice or treatment from your personal physician. All readers and viewers of this content are advised to consult their doctors or qualified health professionals regarding specific health questions. Either Dr. Shaft or Dr. Brownstein will be held liable for misuse of this content. Dr. Brownstein is a board-certified family physician in West Bloomfield, Michigan, and the medical director for the Centers of Holistic Medicine. He's also won numerous awards for his work and has been featured both nationally and internationally for his work, and he's in great demand, by the way. He's also the author of 14 books, including a best-selling book, Thyroid. Dr. Brownstein, thank you for joining me here. I'm excited to be able to talk about some of the things that you've found has been successful in your own practice. And I just am really interested because we're right smack dab in the middle of the COVID-19 pandemic when we're videoing it. It's April 5th, 2020. And so if you see this a month later, everything may have changed drastically and things may have changed as far as the number of people who are ill with it. But right now, you were talking on another interview with your own cousin, who is a chiropractor as well, and he has COVID-19 as well, and you've been taking care of him. Can you tell me a little about this?
Well, I posted the video to my website, which is at www.drbrownstein.com, and Jeremiah called me, and I knew he was sick, but since I didn't hear from him, I assumed he had gotten better, but he called me one night, said he can't breathe, and you know, that's certainly one of the symptoms of COVID. And Jeremiah's a few years younger than me. He's in good health and, you know, has no comorbid conditions. So he was telling me that he was short of breath walking to the bathroom. He's fine if he sits in a chair or lays down. And if he walks up or down the stairs, you know, in his house, he's got to sit down at the top or bottom for 10 to 15 minutes to catch his breath. So he certainly got my attention with that. And I asked him, you know, what are you taking for this right now? And he said the only thing he was taking was vitamin C. Well, you know, I've been writing since the beginning of this that my partners and I have been in practice with just over 25 years. And, you know, I told them when this thing was coming, I told them that the first 24 years of our practice, we're getting ready for something like this. I said, we're ready for this. We know what to do for viral illnesses and flu-like illnesses, and it's using high-dose vitamin A, C, D, and iodine, and IV versions or IV therapies of ozone, hydrogen peroxide, and vitamin C when it's needed, and nebulizing peroxide and iodine. And the combination of those things really helps people with any flu-like illness. So when COVID was coming, I was certain we had the right therapy for it, even though we didn't know at that point. But you know, over the last few years, none of us can recall a patient hospitalized for pneumonia due to the flu. None of us can recall a death from pneumonia due to the flu, and there's 50,000 plus deaths a year in the U.S. for this. And now into this COVID illness on the date, you know, you said that today's date is April 5th. We have not had a patient hospitalized, not had a patient ventilated, and no one's died yet. And we've had a number of patients with it. And we find that using the protocol that I've been writing about, you know, high dose vitamin A, C, D, and iodine, and then coupling it with nebulizing intravenous and nebulizing hydrogen peroxide and iodine, you know, helps out the vast majority of patients. And the really sick ones, we've been meeting in the parking lot because we don't want them in our office, trying to keep our staff safe and keep the other patients safe. So we gown up in full protective gear and go in the parking lot and give IVs of vitamin C and ozone if we need to. And the combination has worked dramatically well. And, you know, I've been posting the videos, you know, on my website about it.
That's really wonderful news. Have you, so your cousin is basically on the mend and doing life back to
So,
normal?
so let's go back to Jeremiah. So he was taking vitamin C, but he was short of breath. He wasn't taking the other vitamins. So, I talked to him about adding in the A, D, and iodine at high dose. And the A, for acute dosing of A, I use 100,000 units a day for 4 days. Vitamin D, 50,000 units a day for 4 days. And iodine, most of my patients are on 25 to 50 milligrams. When they're sick, I just tell them to double it or, a little bit more. So about 100 milligrams of iodine a day until they feel better, and then they can lower the dose back down. And then vitamin C to bowel tolerance, whatever that is. Usually when you're sick, you can take more vitamin C than when you're not sick. So I put him on that, but I was more concerned with his shortness of breath. He doesn't want to go to the emergency room. Like none of us want to go to the emergency room these days. And so I wanted him to nebulize hydrogen peroxide. He didn't have the right iodine to nebulize. So we were stuck with peroxide only, which is fine because it works. So I sent his wife, Deanna, out on a mission to find food grade peroxide, which she found at a health food store, 35%. So I had her dilute that down in a 10-to-1 ratio to 3%. So 10 parts clean water with 1 part 35% peroxide, and that gives you the 3% peroxide solution that you take from that. Then he took 3 cc's of that diluted solution and put it in 250 cc's of normal saline. Now, they couldn't find normal saline. This was Saturday night. He called me about 5 o'clock. She found the food grade peroxide, but she couldn't find saline at the drugstore. So we made our own saline. We did it. I had him do his own saline at home. So what I had him do was mix a cup of water, clean water, with a 1/4 teaspoon of Celtic salt, and mix it up. Let it sit for about 15 minutes, and then just take the top layer off. Leave the particulate matter at the bottom down there, and make enough so he's got 250 cc's of salt water, saline. And so we put 3 cc's of peroxide in that mixture, then drew off 3 cc's out of that dilute mixture, and he nebulized it. And after the first nebulizer, he was feeling better. And after the second nebulizer, he told me he was 75% better. And I had him nebulize every 2 to 3 hours at night and into the next morning. And by the next morning, he said it was almost gone. And then that was Sunday. And he texted me on Wednesday and was fully back to normal. And that we started that nebulizing Saturday night. I can't remember if it was Saturday night or Sunday morning. He said he was playing basketball with the kids.
Wow.
Where he couldn't, walk to the bathroom before. So his story has repeated itself over and over in our practice, and it's, it really does work, and it's safe and effective. And, after this whole thing's over, and right now, everyone should have a nebulizer in their house just in case.
That's quite an amazing recovery, that's for sure. At this time, because you're a board certified MD, what is the treatment currently for COVID-19 patients?
Well, the conventional treatment is you isolate yourself and you stay home and you don't do anything until you can't breathe, and then you go to the emergency room and they give you high dose oxygen and hopefully give you time to recover. And if they don't, then they intubate you, and you don't want to be intubated because the death rate is so high once you're intubated for this. They don't really do any therapies, although now they're starting to try the vitamin C therapy. I've been harping about this on my blog post for a good 6 weeks, and they're trying the hydroxychloroquine Zithromax thing, so we'll see. But, my feeling is every patient when they hit the ER should be given an IV drip of vitamin C right from the start. And, the therapy we're doing works. What I've told a high up doctor at one of the local hospitals that I'm friends with is when the patients hit the ER with this, they should be given an IV vitamin C drip, and they should be given a nebulized peroxide solution to start nebulizing, and then they won't need to be ventilated. That's my take on it.
That's and definitely now everybody's grasping at straws, and so many people are so they're terrified. The world is in a panic state right now in so many
So
ways.
I posted a blog post today, about this fear level, and I feel like the fear level's at a 10 out of 10 on all of us. And let me tell you, if I start looking at the news, I can feel that knot in my stomach start to take hold of me, and I got to stop. But the fear level is way out of proportion to what this is. This thing is very serious, and we've got young people who are ventilated and dying. And I'm not minimizing this at all, but we're not talking about Ebola or hemorrhagic fever where 50% of people get something and they die. The death rate of this thing in the end is going to be close to the flu death rate of 0.1% or maybe a little bit higher. But 99.9 some odd percent of us are going to survive this no matter how many die at the end of this. And we need to all keep that in mind. I mean, this is serious, but I think if we do some of the holistic things that I'm outlining, which also includes, eating good, getting sugar out of your diet, exercising, drinking water, taking your nutrients, as a baseline, that even if you get hit with this, you should hopefully have enough stamina to, fight it off like you would a normal flu-like illness.
That's it's all great. It's all great to hear all the positives at this point in time, like I said. And the research shows that your immune system gets depressed when you get depressed, right? And that is counterproductive for everybody, absolutely.
But, and the stress we're under now is, you can feel it. It's palpable for all of us. The whole country, we're in lockdown. Who businesses are going to go under? I don't know. We're talking about it because it's upsetting to me, and I don't quite understand how we're in this situation. We should have handled this virus when it occurred in January much more aggressively, like other countries did, and we wouldn't be in this mess right now. But we're in the mess. We have to deal with it, and since we have to deal with it, take vitamin A, C, D, and iodine, and you nebulize if you get sick, and and take care of yourself and eat better, drink water, exercise, do all the holistic things we should all be doing. This is a wake-up call for our whole country. We're too heavy, we're too sick, we're eating badly, and I think that's another reason why we're getting hit so hard with this.
Absolutely. Well, I really want to take this time. If there's anything else you want to interject here, but I'm really thankful for you sharing this information, and we'll do our best to get this out to as many people as possible. And would you be interested in updating progress as time goes on as well?
Sure. And, I just tell the listeners to drop the fear level down. If the worst case scenario happens, that, like Fauci said earlier in the week, 200,000 are going to die from this, it's a lot of people. I'm not minimizing this. It's terrible. But 200,000 out of 329 million people is 99.4% of us will do just fine. And get over this. 0.6% would die from it. I'm not minimizing those 0.6% who are dying from this, but the vast majority of us aren't going to die from this. This is not kids dying in the streets. This is not kids being paralyzed by something. This is, a serious illness that the vast majority of us are going to survive and get beyond. And, we need a country. We need to toughen up and get past this. And, the news media is not helping. They're reporting no positive news. That's why I'm writing my blogs, to try and give people some positive news and putting the case histories up there.
Well, thank you, Dr. Brownstein. I really appreciate this, and we will keep in touch and keep on fighting the good fight.
Thank you. Thanks for having me.
Thank you so much.